All right, guys, right now I am going to show you a quick and simple little drill of how to breathe using your nose, which is going to access our diaphragm, which is going to help us engage our core on a higher level. So this is something that needs to be practiced. It's definitely a skill. If you've ever struggled with any kind of lower back pain, this has helped me. I've actually had that struggle where my back pain was just not going away, and no matter what I stretched, no matter what I did, it didn't help until I learned how to do this technique. And all it is breathing in through our nose, accessing our diaphragm, exhaling through our nose or our mouth, just depends on you. I'm gonna place my fingers right underneath her rib cage and my thumb at the lower part of her back, and I want her to sit tall, and I want her to take a big inhale through her nose and try to expand into my fingers and my thumb. So go ahead. Now full exhales. Good. Big inhales, really try to expand. Yeah, there we go. Exhale. Big inhale. Exhale. Do a little breathing intro with the nasal mechanics of breathing in through our nose and breathing into the lower part of our belly. That's gonna access our diaphragm. And this is how we learn how to brace our core, and hopefully it'll help your back feel better. We're gonna teach you how to do something called intra-abdominal pressure, IAP. So the first things we're gonna do is just simply breathe. So go ahead and breathe in through your nose, out through your mouth, do the best you can. And what you're looking to feel is just this area right here, your belly, right around the belly button, is rising and falling. The chest can move a little bit, but just start to pay attention that the belly moves first and the chest moves second. This is also referred to as wave breathing. So when we breathe in, we go in through the belly, then maybe the chest rises, then the chest falls, and the belly falls. So I'm gonna place this yoga block on top of her belly so you can just see how it moves. Good, and exhale. A couple more deep breaths. And exhale. So part of bracing, and just keep breathing, part of bracing is being able to create what we call neutral spine and push that spine into the ground, which activates some of our core muscles. We do this by taking a big inhale. We create pressure. So think of like a Coke can, right? When it's full of soda or whatever, and it's pressurized. So when you squeeze it around the sides, it's really hard to squeeze. But once you open it and pour some of the Coke out, you can squeeze it from all ends, and you can crush the can pretty easily. So basically, the inhalation into our belly using our diaphragm helps create more internal pressure, and that pressure helps stabilize your core. So if you're lifting things, moving things around, or if you struggle with a little bit of lower back pain, this can be a very useful tool. So the way we're gonna show you guys is I'm gonna take this band and I'm gonna put it underneath the low part of her back. So let me put this under here real quick, Sarah. There we go, okay. So Sarah, as you can see, the band's underneath there. It's a really thin band. So just start breathing normally. And from right now, if I pull on this band, I can easily yank it out. See that? So now let's put this band right back underneath there. All right, so it's under the lumbar curve of her back, just on the opposite end of where her belly button is. Now what I'm gonna tell Sarah to do first is push her low back into the band. Go ahead. Okay, now she's starting to push the low back into the band, and what she's gonna do is she's gonna take a big breath in through her nose. So go ahead and do that. You can see this rise, and then what we're gonna try to do is I'm gonna try to pull this band out now. You can see that it's really hard to get this band. She's basically got that spine in what we call neutral position, and she created some pressure internally, and her core is on 100% lockdown mode, and that's pretty much it. So just to review, she's gonna take a big breath in, push down into this band, and I'm gonna try to pull it out. Everything's on lock, and I can't. So that's the first part. Now, the skill of this, because this is a skill, it takes practice, and it's something I highly recommend trying to do every day, maybe multiple times a day if you are in some kind of pain, is the exhalation and keeping that pressure on is where this becomes difficult. So, let's start over. So she's gonna take a big breath in, push down with the back, and she's gonna try to exhale and keep the pressure on. Go ahead. So she just exhaled, and she's gonna do it again. Take a big breath in, push this out, good, exhale. So if you notice, there's not a lot of movement in the yoga block anymore. She's constantly pushing out to maintain what we call the intra-abdominal pressure, and that supports this system in staying strong. We have a straight spine, and it takes practice, guys. So practice this. If you have any questions, feel free to reach out to us.